It is about time to care of your health naturally. This video will discuss the side effects of mental health medications and how to heal yourself naturally. On this video, we are going to discuss the side effects of mental health medications and how it impacts our health. Mental health is our old age issues. It is huge, dedicated, and complex topic to deal with. According to the Bible, most of the leading characters of the Bible were suffering this illness. A leader like King David, King Saul, Abraham, Joseph, Job, the prophet Elijah, and the list go on. We are suffering this illness. In our generation today, most of our CEOs, directors, presidents, leaders, doctors, professors, pastors, they are suffering this illness. Unfortunately, some of them may not even know they are suffering from it. And on the other hand, some of them know they are going through it. They are even ashamed to tell their followers, their loved ones, family members, that they are going through these health issues. As a holistic health coach, when we sit with these people, we know that they have some of these health issues. But they will only tell me, bro, I'm good. Are you okay, bro? You have to take pills after every hour. Every day. What do you think you are doing to your health? And a brother who want to share love with you, or a sister who want to share this love with you, this passion with you to help you, they say, I'm good. Then somebody have to back off. Leave them alone. What do you think about this? Let us watch a video.
In black men, many suffer in silence.
We are alone at the very time that we really need to be reaching out to others.
I'm your host, Dr. Lonnie Joe. Depression is one of the most common mental disorders in the United States and affects an estimated 17 million people each year. Black men are just as likely as anyone to have depression, but less likely to get help for it. Left untreated, depression can lead to chronic conditions like diabetes, high blood pressure, sexual dysfunction, substance abuse, and even death. According to the Centers for Disease Control, suicide is the third leading cause of death for African American males aged 15 through 24. Black men can no longer live in silence and in the shadows of this treatable condition. Here to shed more light on this topic is Dr. Harold Woody Neighbors. His research focuses on developing community-based programs that improve the health of black men. Dr. Neighbors, welcome to the program. Thank you for joining us, Woody. Excellent. Black men seem to suffer disproportionately from the disease. Black men. Why? Woody, in the African American community, the church plays a big role. When it comes to this disease state of depression, where does the role of the church come in, the role of the pastor, this interaction with black men? What role does that play, and where does it come in with African American men?
Yes.
Medical treatments of other sorts, different approaches that help people deal with and overcome their depression. Will you speak to that?
Well, this is where it can get kind of interesting. One of the things I guess I'd like to let folks know is when you get to the point where you're feeling like, whatever's going on with me, it's pretty extreme, I need to get a professional's opinion. I would encourage people that if they can afford it, to get more than one opinion. So those options are out there for folks. I think a lot of us aren't aware that the kind of help you might get depends on who you ask. Yeah, I mean, one thing we should all be against is loneliness.
Absolutely.
That's a place that we discuss come up with a solution for natural healing. How do you help yourself? In fact, dealing with depression among other mental health issues is sometimes very dangerous, especially when the patient depends on drugs and medications that may cause other health issues, which may lead to serious addiction problems and difficult to get off the drugs, just like street drugs. It is ridiculous dealing with the symptom only. It is imperative to deal with the cause of the illness. Some of them, we will sit with them, we know that they have these health issues, but they are too proud. Tell you, bro, I'm good. I'm good. Are you okay, bro? What happened to your immune system? What happened to your kidney? Your liver? That you are telling me you are okay. I have to back off.
Peter Gurtje. I'm director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The drugs and antidepressants also make people fall and kill them. And then they interact in ways that we know almost nothing about. Very many elderly, they take more than 5 drugs a day, and we actually don't know how these drugs interact with each other. So they are definitely harmful in the long term, and probably all of them cause permanent brain damage, because doctors can't handle them. Now it's more chronic, and what they don't realize is they created this with their drugs. Drugs, that when you start taking one drug, it doesn't take long before you're on a second drug and a third drug, because side effects of the first drugs are often interpreted as if they were new diseases. So if you start with an antidepressant drug, you can become psychotic. This is terribly, terribly tragic. And to treat children or depressed adults with antipsychotic drugs, in my view, is very, very wrong, because antipsychotic drugs are among the most toxic chemicals ever invented, apart from cancer chemotherapy. But if you have cancer, it's serious, and it can kill you. But antipsychotic drugs are very bad drugs. Actually, the newer antipsychotic drugs like Abilify and olanzapine, Zyprexa, and what they're all called, Risperdal, and so on.
There are the side effects of antidepressants, which are numerous. Some of the most prevalent ones include nausea, increased appetite and weight gain, loss of sexual desire and other sexual problems such as erectile dysfunction and decreased orgasm, fatigue and drowsiness, insomnia, dry mouth, blurred vision, and constipation.
For starters, therapists are supposed to diagnose everyone. I was a therapist in New York State, a licensed clinical social worker with therapy. And diagnosing people is incredibly stigmatizing. It can really actually cause people a lot of harm. And when you're in a field where you don't want to do any harm, why do you want to do something that's an intrinsic part of the field that actually so often harms people? Also, these diagnostic categories are quite arbitrary. Basically, you can stick most people in any number of these categories at any given time. So really what that does is that gives the therapist a lot of power to label someone with something that really doesn't have a lot of meaning. But that's just one thing that I found ridiculous. Another thing is this whole thing about medication, psychiatric drugs. We're supposed to push people, therapists are supposed to push people into taking psychiatric drugs. For if you have this problem, you're supposed to take this drug. This problem, you're supposed to take this drug. Oh, you have sleep problems, you can take this drug. And oh, you have this kind of mood problem, problem or this kind of mood problem, well, you're supposed to take this drug or this drug. And if you have a side effect of this drug, you're supposed to take this drug. And it becomes really ridiculous, especially when you consider how unhelpful and downright dangerous so many of these drugs are, and how difficult it is to get off these drugs.
And that often comes to mind when thinking about cannabis usage is how does frequent marijuana use increase the development of mental disorders, such as psychosis, schizophrenia, depression, and bipolar disorder? And is there even a link between cannabis and these mental health illnesses?
America has a problem, and we need to see a doctor. So we're very fortunate today to have an appointment with the nation's doctor, Dr. Vivek Murthy. Welcome. So how do you look at the national mental health crisis? What do you feel are the most significant indicators and the most worrisome indicators of America's national mental health crisis? The medication also has to connect with the communication, be different. We need new medications. We haven't seen much advance in anxiety and depression disorder medications for decades.
It's about time to take care of your health naturally.
Mr. Askew is going to be signing the sheets at the back of the room. He will also be collecting the evaluations, and he has.
I have a question. I heard about this on that side from, this is going to me, but this is the first time I'm hearing about the consequences of it. And there's always these, written panels about, okay, just fill out your name here and we'll fill out the rest. Is there anything that you in our communities?
For giving us your attention, engaging with us, asking the questions that you did. I hope gentlemen said in the